reflecting on the words of Dr Hilary Cass herself. She referred to the public discourse around gender identity and gender identity healthcare, describing it as increasingly toxic, ideological and polarised public debate. I think that we can all recognise that description. I think that we can all recognise that the nature of how we talk about these issues, including here in the chamber of the Scottish Parliament, really matters. It matters because toxic and polarised discourse does nothing to serve young people who are questioning their gender, nor those young people accessing gender identity healthcare, nor their families, nor the NHS staff working hard to care for them. So in my closing remarks, I also want to make a plea for a more temperate debate, with less heat and more compassion. There is much I think we can agree on across this chamber. We agree that children and young people and their well-being is at the heart of all our concern here. That's why we welcome the Cass report and recognise its significance. That is why a senior clinical team within the Office of the Chief Medical Officer in the Scottish Government is already giving careful consideration to each recommendation in the context of how NHS services in Scotland work. We agree that evidence matters. That is why we are already engaged with NHS England on the planned clinical study on puberty blockers, and why Scottish Government have already awarded funding to the University of Glasgow to establish a programme of research on long-term health outcomes for people who access gender identity healthcare in Scotland. Yes, I'll give way.
Standish Gulhani.
Thank you to the Minister for giving way. Which of the 32 recommendations do not apply to Scotland? Minister.
So, it is absolutely clear to everyone in this chamber that NHS Scotland is different from NHS England. We have different structures, and it is simply not possible to adopt all 32 recommendations. Recommendation 5 refers to a statutory instrument that applies only to England. Recommendation 9 refers NHS England National Provider Collaborative, which Recommendation 12 suggests is not yet established. Recommendation 11 covers commissioning and potential subcontracting by NHS England services. And Recommendation 30 covers NHS England contract management. I have absolutely no doubt whatsoever that the recommendations and the full report provide evidence that we can learn from in NHS Scotland. But it is simply wrong to suggest that we can wholesale adopt all 32 recommendations. Now, we agree that high-quality healthcare standards matter, and that we all want people to have safe, evidence-based, holistic healthcare. That's why we commissioned Healthcare Improvement Scotland to produce national standards for gender identity healthcare. We all agree, as the Cass review recommends, and Dr Hilary Cass highlighted when she gave evidence yesterday at this Parliament's Health and Social Care Committee, that healthcare professionals who work in both this special field and beyond need good training and support. That is why we commissioned NHS National Education for Scotland to develop a transgender healthcare knowledge and skills framework and explore resources and opportunities for training for NHS Scotland staff. And we all agree, I hope, that this is not an issue to treat as a political football. The Cass review is a serious report. It requires serious consideration. Many of its recommendations are already in train or delivered in Scotland as part of the work implementing the Strategic Action Framework for NHS Gender Identity Healthcare Services. There will be more that we can learn too. I'm afraid I'm in my closing moments. So, that is why, through the work of the senior multidisciplinary team of Scottish Government clinical advisers, we are already thoroughly examining the recommendations of the NHS England commissioned report and its applicability to NHS Scotland services, and we will update Parliament on the outcome before summer recess. Thank you.